So let's do introductions. Let's start in this room.
Jessica McGinnis, Drug-Free Community Coordinator.
Michael Walden, Executive Director with the Southeast Kansas Juvenile Detention Center.
Cameron Hicks, Assistant Director with the Southeast Kansas Juvenile Detention Center.
Mary Hunt, Workforce Program Director at Southeast Kansas Works.
And Marcia Davis with Thrive. So let's have Robin. She's still
Hi.
on.
Yeah,
Yeah.
so I'm Robin Lohman, and I'm actually with KDADS too, so I'm happy to see another KDADS member here. But I'm just a member of the Iola community and a board member of ACMAT.
Bailey.
I'm Bailey Whitey. I'm a community health worker for CHC, but I'm stationed in the school district in Iola.
Mindy.
Mindy McCorkle. I am the new Southeast Kansas Community Support Specialist through DECA.
Tiffany.
I'm Tiffany Davidson. I'm the new nurse for the Allen County Health Department.
Laura.
Laura Hoppus, and I'm with KDADS. I'm the problem gambling specialist for Southeast Kansas. This is my first time joining you. Hello to some familiar faces. And we are working with some task force out of Crawford County. So I appreciate you letting me join you.
Pamela.
Hi, I'm Pamela Thompson. I work for Family Strong. We serve Southeast Kansas. I'm located in Pittsburgh and just glad to see you guys all again.
Tegan.
I'm Tegan Kern. I'm the Drug-Free Community Coordinator intern, and I am also a clinical intern with the Southeast Kansas Mental Health Center.
Bruce.
Hi, I'm Bruce Symes from the Allen County Commission, and I work at the college.
Alicia. Elsa.
Yes, hi, my name's Elisa Nurbis. I know I have a fantastic name to pronounce. So I am the new program evaluator from Greenbush, and Linda Weldon has retired. She was the evaluator for the Drug-Free Community Program. And so I am taking her spot and supporting your coalition through that grant. So thank you for having me on.
Oh, welcome. Cassidy.
Hello, everyone. Cassidy Lutz. I work for the Southwind Extension District, so I cover Woodson, Allen, Bourbon, and New Hampshire counties. I am the Family and Consumer Science agent.
Awesome. And Kristen.
I'm Kristen Wright. I am ACMAT Treasurer and with Emprise Bank.
And Lacey.
Hi, I'm Lacey O'Malley. I work for KDHE in the Community Health Promotion section, and I cover kind of from Lyon County to Cherokee County, so Allen's smack dab in the middle of that.
Huh? And we had two people come in. Yay, Marie's here. She can take over.
Oh,
Yeah,
but
Carol.
I come late.
So introduce yourself.
I'm Marie Parker with CASA, co-chair of ACMAT.
I'm Amy Daniels with CASA.
Ooh, it's a chilly walk.
Okay, Marie, you're highest official.
All right. So our agency in spotlight is Southeast Kansas Juvenile Detention Center. Michael Walden, you ready?
I believe so.
Okay.
I believe so. Like to thank everyone for being here today, and thank you, ACMAT, for having us come on as a spotlight for our agency. Again, my name is Michael. I'm the director of the Juvenile Detention Center in Girard, Kansas. We service 11 counties of Southeast Kansas. So we have a pretty large region that we service. Facility started as an interlocal agreement late 1992, I believe. 93, it actually was incorporated and opened in 1994. And since that time, we've been able to service the 11 counties. We have residents from the ages of 10 to 17. They're felony offenders. So they make contact with law enforcement, and then law enforcement gets all the juvenile intake. They decide and determine whether or not that kiddo's coming to see us or not. Once kiddo's there, they usually are before a judge within 48 hours, or they're released from custody or from our facility and back into the communities. Currently, the length of stay for individuals is about 2 weeks. It's just a little shy. It's actually 13.9 days. But we generally have them for 2 weeks. We do see some kiddos that are there for a little longer, but we are considered a short-term facility, a short-term stay. So kind of picture your county jail for juveniles. So we get them for a little while and they usually leave us. Sometimes they go and get treatment at different facilities and things of that nature. After a court order's been put in place. We do house, we are co-ed, so we do have guys and girls that are there. And we also have education provided there as well. It's through our local unified school district of 248, so the Girard School District. And our educator is through Greenbush, actually. So I know somebody was here from Greenbush, so appreciate that partnership with us. And we have had Mr. Dustin there as our educator for probably around 10 years, probably now, I'm guessing. He has a really good rapport with the kiddos, and basically we just want to make sure that those kids that are in our facility are maintaining that education piece. A lot of kids that come into detention, around 40 to 45%, have some kind of a deficiency in education. So we definitely want to try and make sure that we're supporting them there and that aspect for success. Also, in the past, we really didn't do much for the mental health aspect for our kiddos, simply because we weren't required to, as horrible as that may sound. Again, we're considered short term, so they don't want to keep them there. They want to just get them there, find out what the court wants to do, and then get them to the place they need to be, whether that's some kind of treatment center or back home, to try and preserve that family. I've been in my role for around 15 months, and one of the first things that I wanted to do is I wanted to introduce the mental health aspect and piece into our facility. So I began partnering with Crawford County Mental Health to help the whole individual. And we get some kiddos that might be in a little bit of a crisis here or there for one reason or another. And whether it's mental health or substance abuse or behavioral health, we want to try and get them some kind of help. And so we partnered with Crawford County Mental Health to do that. So that's a new service for us that we started last year. And it's been a really good partnership with us and for us and for the kids. So we've seen some successes there. Another thing that we implemented and have done is we are doing a group and a group therapy in the evening twice a week. We try and maintain that twice a week the best we can. And I don't have a social work degree, so if I don't have the acronym correct, I apologize, but I think it's CBT based group therapy. If that's wrong, I apologize, but I think that might be right. I'm not, Mindy's shaking her head, so I hope that's correct. And so that helps too, because what it does is it gives the kids an outlet. When they see us in blue, and we're considered LEOs in their eyes and in the court's eyes, they don't always want to talk to us about what's going on with them. And I understand, I get that, and I could see that, and I could see their point in that. So them having an outlet in the facility to talk about what's bothering them and what's on their mind has been really good and beneficial. Along with that, we've seen a lot of kiddos that come in with psychotropic medications and things of that nature. And so we have a physician that comes in Monday, Wednesday, and Friday. So we actually have a doctor that comes and they have an opportunity to see the doctor, like a doctor's visit. They've got a cold, they can see the doctor. If they play basketball and hurt their leg, doctor will look at them. If we need to get an x-ray, we can go do that. And so we provide that service for the kiddos. However, with the kids coming in with the psychotropic medication, our physician is just a family practitioner doctor. He doesn't specialize in those kinds of medications. So we've partnered with CHC of Southeast Kansas. So I think maybe somebody was with them too, maybe in here. And what they've done is they've been able to be our oversight for that medication. So that way we can get those kids checked. Maybe we notice something in their behavior and how they're responding to that medication, and we can put a referral in, or have our physician at our facility put a referral into CHC to say, hey, this kiddo might not be on the right meds or might not be responding well to these medications. Can we review those and have them looked at and maybe change that prescription? And of course, we partner with the parents and things of that nature as well. So everyone's included in that. But we definitely want to make sure that we're servicing the kiddos, because ultimately they're going back into our communities and we want them to be better than what we got, right? So we want to send them back into the communities as best equipped as we can. The other thing that we have done with that is we've been able to get prescriptions at a reasonable price and things of that nature, especially with those types of medications. It can be kind of difficult and stuff, and we don't want to burden a family with those kinds of things. So we try to keep those costs as low as we possibly can. And a lot of times they're at no cost, to the individual, to the family. So we've been doing a really good job with that. And CHC has done a fabulous job. The psychiatrist will book an appointment and they'll come in, and we provide a safe space for that to happen, where the confidentiality of the individual and the practitioner could be, they can speak freely and openly and take care of the business that they need to, and those evaluations, and make those adjustments on those medications if it needs to be. Sometimes it doesn't. Sometimes they're right where they need to be, but at least we know we're doing the most that we can for the kiddos while we have them. The other thing that we're working on is we are working with a private practitioner for substance abuse, but we also reached out to DECA and had a meeting with them. I think Heather and Ed, and I can't remember who else was with them the other day, come to our facility and met with us. So hopefully we can get some more focus on substance abuse. Unfortunately, we see a lot of that, especially with the criminal justice side of things. We definitely see a lot of youth who are struggling with those addictions and things of that nature. So we want to try and provide the best services we can for them as well. The other thing that we have done and have been doing this past year is working with our community corrections out of Crawford County. So our facility is located in Crawford County, but it's not necessarily owned by Crawford County. And I think it's important for the folks in our surrounding counties to know that even though our facility is physically located in Crawford County, we're just as much Allen County as we are Crawford County. We're just as much Bourbon County as we are Neosho County or Lynn County, because we're part of this interlocal, we're part of this group together. So each county has an invested interest in our facility, and we're there to provide the best services we can for our kiddos and for our counties, because ultimately we work for all 11. And so that's really important to put out there. But RJA out of Crawford County is able to come in, so we push in some services through them, which Catch My Breath, which I think some of you might be familiar with. If not, it's dangers of vaping and substances such as that. And there's another one that's marijuana based, and they've got a couple other programs that they're working on as well, which I think is really gonna benefit the kiddos. And it also not only benefits them in learning about the dangers of things, but it also counts as community correction work. So if they have to have so many hours of classwork, this will also help them. So it does two things there. So we're really glad about that. And they're also doing an anger management as well. And it's all data based and everything like that, you know, where it's evidence-based, excuse me, evidence-based programming. And so they have certain things that they have to meet and criterias and things like that, so that it's they can get credit for what they're doing when they come out. Because the stay is so short, it's that 2 weeks, it's hard to get kiddos in there to actually complete the whole program. So what we're trying to do is, we're kind of waiting for the Department of Corrections to get with us on a care coordinator so that we can make sure that when a kiddo leaves us, that information goes with them, wherever it may be. If they're going to a different facility, if they're going to their home county or a foster home, or wherever they're going. That way we can get the services started in detention, but then they can continue those services wherever they may be going. So right now, Cameron and myself, we've been really kind of working back and forth and just trying to make sure that those connections are made for those kiddos and that they can continue the services that they've been receiving in detention. Again, we understand that we're not going to be able to fix everyone that comes in our doors, but we definitely are encouraged by the fact we can get services started for them, you know, and at least hopefully get them some tools in their tool belt so that they can do better things and make better decisions when they leave our facility. Again, recidivism is a big deal, especially in corrections. And we want to try and reduce that number of kids coming back that we can. Unfortunately, there are some kiddos that are just, you know, caught into that life. And when I say that, we've had children who have been in detention. Again, we've been open for 30 years this August. So we do get kids of kids that were in there. But if we can give them the ability to have a safe space to talk about what's going on with them and get them help, then we're providing that service that's going to help them in the long run. So as far as our facility goes, that's less punitive than we were before. Obviously, we're a correctional facility first, so we need to make sure that they're safe and secure. But I think if we're not pursuing those aspects of mental health, behavioral health, and substance abuse, then we're really doing them a disservice. So I think it's a good benefit to the kiddos. And it also forces my staff to grow in their thinking. Because when you've been doing something for so long a certain way and you're throwing something at them, you know, they have to think on their feet and things of that nature. And they've done a really good job. So I'm pretty proud of our team back at the detention center and learning and growing with the kiddos. And it's definitely been different for sure. And you know, on top of providing a space for psychiatrists and social workers to come in and our groups that we're doing, we're still a detention center. So we still have to maintain our court appearances, making sure that court services, probation officers come in and get the kids seen and things of that nature. So we've got a lot going on in detention. So that's kind of where we're at this point. We're hoping that we can still add some things into detention. We're also working on a literacy grant that we received by one of our foundations, our local foundations in Girard. And we were able to purchase some new books and things of that nature for our library. And hopefully work on literacy with the kiddos and stuff. And they've seen a slight improvement. And I think having books and things of that nature that they're interested in reading helps encourage them to read more. So we've done that as well. So I know there's a lot of different agencies here But if you have a kiddo that you're providing some kind of service for, whether it's DECA or CHC or even Southeast, the mental health center here in Southeast. If you have a kiddo at detention, please reach out to us and let us know. We'll make sure that whether it's a Zoom meeting that you have with them, or you want to come and see them physically or do a non-contact visit, we'll make sure that happens. We want to make sure that anything that they have in place now is available and accessible to them while in detention. So.
And how many children can you take in, or what's your capacity?
Yeah, our capacity, we're a 25-bed facility.
Wow.
And we can actually hold up to 28. So we have the room for 28, but 25 is where we're at. And I think we had 9 this morning. The last couple months we've been varying 11 to 14 kids. So, and again, we get them from everywhere,
What's the average age?
Oh, average age probably around 14. 14. It's about their average age.
This is Robin. I had a quick question. You may have already covered this, and I apologize if I missed it. But what's the criteria for being admitted? Is it legal court stuff, and they get ordered there? Is there any kind of voluntary admissions,
Sure.
or what does that look like?
Very good question. So when a kiddo breaks the law and they have contact with law enforcement, they're taken to what we would call JAC or juvenile intake. Sometimes the juvenile intake will be at the sheriff's department, sometimes at the PD department. But what happens is they use what they call a KDAI instrument. And it's a series of questions. It's just an assessment to see the risk factors for the community and for the youth to go to detention. And based upon that, determines whether or not they come to detention. Sometimes we have a kiddo who might be a first-time offender, but the offense is such a risk factor that instrument is overridden by a judge or district attorney, and they go to detention anyway. Even though they might not score enough points, the risk for them or the risk for the community might be so great that they send them to detention anyway. It doesn't happen as often as it used to. 7 years ago, we'd have 25, 22 kids just about every day, and our average was 16. What happened is they reformed the juvenile justice code. So we don't see the same offenders we used to see. A lot of the status offenders don't go to detention anymore. Usually they go into foster care or they stay home. So that's why there's such a decrease.
Jessica, can you check chat and read questions?
What kind of crimes do you see?
Okay, good.
Thank you, Mindy. So as far as crimes go, any crime that an adult will commit, a juvenile has committed. We've probably held, I would say probably 10 murderers or alleged murderers down at our facility. We currently may or may not have a couple of those now. I don't know, but sex offenders, arsonists, any felony offense, we will have a kiddo there. Not always. I mean, there's been some situations that have happened where the kids haven't come and the sheriff's office were, hey, we need to get this kid served. Well, they're not here. Well, what do you mean they're not here? Well, they've already been released. So sometimes there's a timing issue with the police report getting done and sent to the county attorney's office within that first 48 hours. Well, if they don't have that court report, or they don't have the officer's report, the police report of what actually happened in the crime, then the court might just let them go.
Oh, wow.
And now they get issued a warrant, and then they have to go back through that whole process. So
Documentation.
yeah, it all goes back to communicating and documenting, documentation and stuff like that. So, but yeah, any crime. I mean, we have seen a large increase of I don't know, sexual offenses, sexually related offenses since COVID than what we had in the past. And I don't know if it was because we were all cooped up for so long and that was a factor. I don't know. But I know we've had some situations where kids who used a firearm or a weapon didn't come to detention. And that's something that, makes a guy like me a little nervous to know that a kid who tied an individual up to their chair by gunpoint never came to detention. They're back out to that community. Because then you have to question like what about the victim, what about them? So I don't know. And there's good things too, like we don't get kids for truancy anymore. 8 years ago, they used to send kids to detention for truancy. And I don't know that was a place for them either. So, it's hard you kind of have to find that middle ground, and I don't know that detention is always the best thing. But I will say with what we're implementing now and what we're doing, if a kid does come to detention, the likelihood of them actually getting help is a lot greater now than what it was 5 years ago, 2 years ago. So I think we're doing a good thing for our communities and for the youth of our communities by providing those things.
Are you seeing any kind of withdrawals from substances there?
We
Or what's
see
the
it.
higher use of substance you're?
We've got one individual who he's come in and out of there for quite some time. And he definitely struggles with addiction and trying to get him to come out of his room or to get any help has been it's tough. I mean, he doesn't, he's not very active in doing that kind of thing. But we encourage him to try. But he's gone to the point where I think he's using methamphetamines and probably I don't know how he's taking them at this point, but some kids we've seen, they'll sleep it off and it's tough go for them because we really don't have much that we can do for them unless it's a medical crisis and something like that. But all the kids that come to detention though have to be medically cleared before they come to detention. Okay. So we make sure that that's it has to be that case. Otherwise we won't take it and we don't have to.
And they're all males, is that correct?
No, they're females. Yeah. That's right.
I've been serving, thank you, Michael, for being here. I've been serving as our county rep on this board for 5 years, a little over. And there's been changes in legislation referring to this score sheet that Robin asked about. And any of you that are inclined to follow along and contact your legislators, it really got harder to place a child in juvenile detention or a young person a few years ago. And so as a facility, we were dealing with lower census and the financial repercussions of that, among other things, staffing and all that. But more importantly is whether or not the young person is a danger or in danger. And there's even the horror story that was shared with me by our judge, who was really against Judge Kreitz is against this tightening up of the score sheet that happened. There was a young person in Wyandotte County who was a victim of human trafficking, was picked up for something and placed with law enforcement, maybe juvenile detention, but law enforcement in some capacity, but they weren't able to hold her because she didn't score on the score sheet. Well, when she was released, she was subsequently killed by her victimizers because they were afraid that she was going to talk. So since that tightening a few years ago, there has been some move by our legislators to put a little more teeth back into the score sheets and the ability to keep youngsters that, it was just, they had to be involved in super violent crimes, it seemed like, to be placed. And certainly you don't want them in there for truancy. But, even theft or holding somebody against their will or property destruction, that can lead to other things, even if it's not egregious enough. And the state's motives were good, I think, in keeping children with families or in schools and not putting them away. But there was also the cynical part of me was there was that money saving motive too. So I would encourage us to follow that along and give our representatives a call and let them know what we think. If you see something happening, money taken away or good things happening too. But I really do appreciate what Michael and his staff does, especially that education and mental health and substance abuse counseling component. Even if a kid's there for a few weeks, it can change their life.
Yeah, and Commissioner Symes, we appreciate you and your support for sure. And he definitely hit the nail on the head. There's been a little bit of a tightening up, but again, there's more that the state, I think, could be doing. And if you research it enough, you'll see that there was an increase in crime within foster care and things of that nature after that Senate bill was passed. And I don't suggest that we put them all in detention, but I do think that when we have them, it at least puts a pause on that situation long enough to where maybe we can introduce some tools and some mental health pieces to try and get them on the right track, for sure. Again, Commissioner Symes, appreciate you.
Thank you, guys. Thank you very much. Appreciate you guys. Anybody else have any questions? Carol, you want to take over? Oh, sorry, Robin.
I don't know, I guess we're kind of shifting topics, but I was just thinking about, what Bruce just talked about, and my heart kind of, my heart hurts a lot for victims of trafficking, but I think we can all kind of agree they're the victims. But but as I was thinking through those kinds of scenarios, I mean, do you guys work with like your local, I always use the wrong word, but abuse shelters? I know ours here is Hope Unlimited, but I'm thinking a referral to something like that for being trafficked might make sense. I didn't know if you'd ever worked with them locally. I don't know what yours is there in Pittsburgh.
Sure, I think we don't work with the house there in Pittsburgh or in Crawford County per se. What we do is we definitely work with the individuals that are coming in that most generally, all of them will have some kind of social worker or a state agency contracted worker. Whether that's PFI, DCF, themselves, or Cornerstones of Care, St. Francis, and I'm probably missing one or something. But we try to work with them as much as we can. And I know that they have told me, it's definitely been a struggle for them as well, especially when you get a kiddo who has been trafficked and they make it very hard for you to put them into detention, even though it's the safest place for them. I woke up, went to work this morning with the kids that we had, And I can tell you right now, I know where all those kids are, and I know that they're safe. So, the unfortunate portion of it is it a jail-like facility? Absolutely it is. But the best part about it is all the kids are safe in there and we know where they're at. And that's a lot better than worrying about the release of a young person, regardless of their gender, and being trafficked by someone and then brutalized or victimized by their attacker when they leave, or maybe that they don't ever come to detention because they were picked up by law enforcement. They were on the NCIC or wasn't listed as a runaway at all. So law enforcement just releases them back to the street because there's no place for them, you know, there's no place they can send them, and then them getting victimized again. So I think there are some things that we can do and put in place through legislation, if the legislation would move on it. And I'm sorry, I'm just reading that. Yeah, I think that sex trafficking task force would be amazing, you know. And we see it from time to time at detention, mainly with out-of-state runaways. Because if a child is a runaway from out of state, we have one right now. She is from out of state. She was listed as a runaway on the national database. The police can pick her up and they can put her in detention because she's an out-of-state runaway. Now, she didn't commit a crime, but she's listed as a runaway out of state. And so we can put her in detention and we can hold her in detention for 90 days. Well, logic would tell me if we can do that for out-of-state kiddos, why can't we do that for our own kiddos who are runaways, who are at risk for human trafficking? It doesn't make a lot of sense to me, but I don't know that they pay attention to a guy in detention over here in Girard, but you know, so there are cases that we see from out of state where we do have those runaways and they are held, and we hold them up to 90 days simply because we have to make those reports to Kansas of neglect or sexual abuse or sex trafficking, and then our state contacts their home state, let's say it's Arkansas, and that state does an investigation there and then reports back to Kansas, okay, this is what we found. Here's where we're going to send this girl. She's going to go into foster care or a group home in Arkansas. Here's where you release her to. Here's a release point. Here's the individual you have to release her to, things of that nature. So they do follow through with some things along that lines, but we only see that with out-of-state runaways generally. Which is too bad. Again, I think if we can do that for other states, I think we should be able to do that for our own kiddos who are out there. And folks, I've seen kids turn themselves in because it's winter and they've been living under a bridge, you know. I've seen kids living in a tent with their older brother. So there are kids out there in communities that are struggling. It's just I think we can find better ways to at least get them into a safe spot and then push those services in to get them on their feet and going. So I don't know if anybody else has any questions.
Thank you very much. Thank you.
Absolutely. And if you don't mind sharing my information, if anybody has any ideas or suggestions of something that maybe your agency is doing and would like to come and maybe speak to our group that we have in detention, let me know. We're open to those things and we definitely can have a conversation about that. So please let me know. Love to work with you guys. Again, I know we're up here in Allen County, but there's a little piece of Allen County down there in Crawford County that belongs to you folks as well. So don't forget that. All right. We appreciate you. Thank you. Thank you for having us. We do appreciate it.
Thank you.
Absolutely.
Yes.
Thank you.
Great information. Thank you so much, Michael.
You're so welcome. Thank you. You're going to
Safe
let you
trip.
finish your meeting. Commissioner Simons will see you on the 23rd. Have a good day.
Have a seat.
All right, thank you.
And my apologies to everyone that I was late to the meeting. But thank you, Marie, for stepping in there and getting it started. So let's move right on into the consent agenda. I hope everyone's had an opportunity to review the agenda, the minutes, treasurer's report. Are there any questions on those?
I would like to add under the donation recognition, Y-Link. What is that? I motion to add Y-Link.
Y-Link. Do you want that kept on here as an agenda item ongoing?
No, just under old business B, if we can just add Y-Link to the recognition list.
Oh, okay, I'm sorry. Okay. So Marcia will be able to get that fixed. So, all right. Do I have a motion to approve the agenda then with that correction?
I'll motion to approve with the correction.
I'll second.
All right, thank you. And so then old business, Jessica, talk to us about the Tony Hoffman presentation.
So on March 21st, we were able to have Tony Hoffman come and speak with our Allen County youth. We had 6th grade to 12th grade in all school districts come. We had approximately 1,000 students, and I'm gonna say about 30 staff that attended the event. We received some great feedback on the first session. My husband actually came and he was so impressed. He actually brought his Allen Community College women's soccer team to the second session. So I thought if he was going to be the most honest with me about the event. So that was a good turnout. I do want to share a few pictures of the event, if I can. So this is Tony speaking to the youth, just to kind of get an idea. He wasn't one to stay on the stage. He was out really kind of speaking to the youth on their level. So we were really impressed with that. We also were able to send out evaluation to the school district to get some feedback. And just to show you, this was just a Google form. We did it really quick. We were going to call Greenbush, but it was a last minute thing. So just note that. But for our overall rating, the students said it was 64% excellent, 27.2% good. On how would you rate the speaker's ability to capture your attention? Again, we got a 44.4%, 5 being extremely engaging, 37.2% very engaging. The relevance of the content, we have about 50%. 37 points, some or yes, and then 34.7% somewhat. So just an overall message. The clearing, how clear was the speaker's message? 52.3% was extremely clear. So this was just really nice to get back. They were able to fill in. Please provide any suggestions or specific areas he could improve on. Their favorite moments. Our demographic here, we're showing that the middle schoolers were the majority of our evaluation takers, which they usually are with our KCTC survey too. So that was good. And then 50-50 or about, yeah, 48. So this was really good feedback. Well, Tony actually had emailed me and would like some feedback, so I'm going to share that with him. So I think that's all I have, but just a special thank you to Recovery House, Allen County Commissioners, the Lofts, and Y-Link for helping us be able to bring this speaker in.
Yeah, that was such a great event. I'm glad you're able to get that pulled off, Jessica. You and Tegan, good job.
Could have done it without Tegan and Debbie.
And okay, fundraising ideas for Family Safety Night, which is June 6th. It'll sneak up on us real quick, just 2 months away. Our committee met and Jessica has our task sheet out, and I think that was emailed to all the people that were going to help send out the donation letters. So hopefully those are in process. And see, and I did go to the county commissioners meeting this morning to get permission to use of the courtyard and the electricity. And they were also very generous in giving us a $250 donation. So thank you very much, Bruce, for your part in that. So, restaurant night and tourism grant. I'll let Jessica.
So I have reached out to rookies and spoke with Carrie Saylor. She's open to having a family night. She wanted to kind of think about it and work out some details, so I would be able to report back at our next meeting, or I will email that information out to the coalition members. But she was willing to offer a certain percentage from a family night to the event, but we're still working out those details. Also, there is an Iola tourism grant that's going to be coming out, and I would be writing for that. And that's majority, I would be writing for really covering the inflatables for our event. But the timing of it is a little off. I think they make their recommendations the first week of June, and that's our event. So we're going to still maybe try to reach out to our sponsors that have been with us throughout almost 11 years now. So we're going to still reach out to our sponsors, but maybe we can start saving up that money for the next year too. So that's kind of where we are on that. And once I get that information, I'll share it with the coalition.
Very good. All right, moving on to new business. Amy Marie from CASA, they had their event in Iola. I'll let you speak on the Child Abuse Awareness Month.
There's a group of 5 different local agencies that have partnered together for Child Abuse Prevention Month. That includes CASA of the 31st, Hope Unlimited, AmeriCorps Senior Volunteers, Kansas Children's Service Leagues, and the Kansas Department of Children and Families. And representatives from all of those groups, plus the county commissioners, Chief Judge Kreitz, and just some people from the public at large, all met with the county commissioners this morning to do a proclamation regarding child abuse prevention being a topic in April federally and in Allen County. And then we went outside and planted the front garden of the courthouse with 150 blue mylar pinwheels. And the entire group went outside, even though the weather is horrible. But it was brief, so we all survived. And it was really kind of fun. We did have the Iola Register covered the story, and Sarah at the Register will be producing some pictures and an article for the paper regarding that. We also met a week ago with the city of Iola for the same proclamation, and last night with the city of Moran, also for the same proclamation. And we'll be doing a pinwheel garden in Humboldt next Monday night.
We do.
So we kind of covered Allen County.
We
And
do.
we're very glad that everyone was available to join us, and it's been a good project so far. Although we're only in second week because we had to start early because we had so many events.
We do 18 events in about 3 weeks time period in 5 counties. So,
Yeah.
I mean, it is a lot, but it's worth it if it helps make somebody aware of child abuse and report it.
We had a lot of good questions this morning from the county commissioners, which we really do appreciate that, because it, at least presents to the group that's present, and they videotape it as well. And that helps us get the message about child abuse out. At the same time, Hope Unlimited did a proclamation for Sexual Violence Awareness Month, which is also April. And it was actually found through both of our verbiage that both child abuse and neglect and sexual assault are on the rise in Allen County, which was really kind of surprising. Although nationally it is as well. So I'm glad we're doing an outreach campaign to bring that awareness to them. Our next big event is going to be the pinwheel coloring contest. And those are in the schools right now, and we'll bring those in to pick winners on the 17th and 18th of the month, and have a big judging ceremony.
Very good. Thank you for the update, Amy. And I apologize. I want to when I went to speak with the county commissioners this morning, Marie was there and Marcia was there for other activities. So I grabbed them and we presented together. So I appreciate their support. Our ice cream social, that has been scheduled for the week after Family Safety Night on June 13th from 7 to 9. So if, again, just mark that date on your calendar. And if you like making homemade ice cream or cookies or brownies or something that could go with the ice cream, or you would like to help serve, please let us know. We would take any volunteers. Time goes quick. You're listening to great music, and it's just a great opportunity to interact within the community. So, okay, Jessica, you want to give us your update?
Sure. Tegan and I were able to help Iola SAD group on March 7th before school on a seatbelt event. We were able to hand out Smarties and Dum-Dums and kind of give some messaging out to those who were not wearing seatbelts. So that was a fun event. Last week, we also took you to the WildLink Advocacy Day in Topeka, and we took students from Iola and Humboldt, and we had the opportunity to sit with Senator Tyson and kind of talk about what their concerns were for our county and our school districts. So that was a great conversation we had. I don't know if anybody's had the chance to go and speak with our legislatures, but we don't normally get a sit down with them. It's usually maybe a 5-minute discussion. Senator Tyson's always been welcoming to us and gives us about 15-20 minutes. So we're really grateful for that time with her. We are ramping up Sticker Shock with all the school districts. On April 10th, we'll be doing it in Iola at 1 p.m. And then in Moran, we'll be doing it April 7th at 2 p.m. We had a scheduling conflict with Humboldt on Monday, so we will be rescheduling that with them to do Sticker Shock. On April 23rd, we will be having a DFC virtual site visit to go over our Year 9 grant. So we'll be going through that, Debbie, Tegan, and I. And then, of course, planning for Family Safety Night.
Okay, great. Tegan, did you have anything you wanted to add for activities?
Jessica has covered everything wonderfully.
All right, very good.
And I just want to say, as well as both of the girls are finishing up their last semester of their masters in social work. So there's a little bit of stress going on, so it needs good support, good vibes. It's
fine. Everything's fine.
It's fine. It's fine. Everything's fine.
They got
One
it.
day at a time.
Awesome. Thank you. Okay. So any upcoming events, agency updates? Who wants to start?
I'll start. Thrive is hosting a Spring into Health clinic in Humboldt on April 24th, 10:30 to 2:30 at the Humboldt Library.
What will you do there?
They'll have some vaccines, and then they'll have some other agencies that have information as what services they offer.
Anyone else have any updates? Just jump right in here.
So I'm very excited. The health department has been working on an initiative to decrease tick-borne illnesses within our community. We noticed a large rise in like alpha-gal especially. And so we got a grant, and we will be doing 4 tick boxes that we'll be putting around Allen County, and we will be providing free bug spray to be put in them. For anyone in the community to use when they're out and about. Hopefully it'll make a difference. And we're looking at trying to get into the schools and give more education to the kids and the parents, and doing more booths and stuff to bring more awareness to the cause. So it's pretty exciting stuff about that, especially with summer coming up.
Good. Thank you. All right, thank you. Anyone else have an update?
Mine is much less important, but if you live in Iola and want to legalize chickens, you should reach out to your local city councilman or woman.
Okay, thank you, Robin. All right, Cassidy.
I'll just go next real quick. I dropped a few flyers for some upcoming events that we have going on throughout the Southwind District. OWL Hour, it stands for Older, Wiser, and Livelier. That's going to be a new group kicking off. It's something new that we're starting. So there's different locations and dates throughout the district. We've got a food waste program coming up. Walk Kansas, that's the exercise initiative that Claire Wyckoff leads, and it's really about encouraging people to get out and get active and be healthy. And then the last one is the Aging with Attitude Expo that Tara helps put on down in Parsons. So if you have any questions about any of those programs, reach out to the numbers or the names listed on the flyers, and they'll be able to help you out.
Great. Thank you, Cassidy. Just jumping over here to the chat real quick. It looks like Bailey Whitey put out oh, I guess that's just if we need anything. Lacey, oh, she's with the Kansas Tobacco Quit line, is offering $30 gift cards to pregnant moms who call and complete coaching calls to stop smoking or vaping. And so there's the 1-800-QUIT-NOW phone number out there. And then Cassidy, I see your stuff there in the chat and the food waste. All right, very good. Anyone else have anything to share?
I have something. So Mary Hunt, Kansas Works. I know a few people hopped on after introductions, but I have not been on one of these meetings before, so it's very nice to meet you all. But we are doing a summer youth employment program at Kansas Works right now, and we're enrolling youth ages 16 to 21 into this, and we're hoping to determine them eligible for our Title I funding, so that way we can pay for it subsidized through WIOA, the Workforce Innovation and Opportunity Act. If they are not eligible for that funding, though, we still want to help place them if they're looking for jobs over the summer. So we still want to be able to work to connect them to employers, and we can still do some soft skills training with them, some job preparation training with them on those soft skills. And so we are actively enrolling for that right now. If you have any youth that are looking for summer employment or now employment or anytime after summer employment, honestly, we'll definitely consider them if they're eligible for our program any time of the year, but really hitting it hard for the summer youth employment right now for those kiddos wanting to look for work in between semesters in college or high school, or in between high school and college, or wherever their next steps are. So if you have anyone that you're working with in those age range, I have flyers with me. I can also email them out to anyone, and I can also email out my information to anyone. And then if you are an employer who is looking for someone to help too, if they're eligible for a program, we can subsidize that for you if you're just looking for someone to help around the office. And there's a youth in the community that you're interested in just getting some hands-on experience over the summer with.
Awesome. Just I'll get with you and I can get a flyer.
Yeah, I brought some with me. I'll leave them with me.
I was gonna say, I would love your information because I'm assuming you cover Allen County.
Yeah, we cover 17 counties from Pittsburgh over to Independence, up to Emporia, and over to Miami County where Paola is.
Okay, yes,
So
I
all
would
the
love your
counties-
information. I've been trying to contact someone for Kansas Works to see if we could get someone to come to the community baby shower in case there were moms wanting help finding jobs. So I would love that if you're interested.
Yeah, I would love to come. And we also have a new career advisor in our Chinook office. We can both come, so that way we can get to know you a little bit more.
I would love that.
Yeah.
All right, very good. Way to partner. All right, anyone else? Okay, if there's nothing else on the agenda, no other updates, do I hear a motion to adjourn this meeting?
I motion to adjourn.
I'll second.
Okay, all in favor? All right.
Aye.
Anybody opposed to adjourn? Okay. All right, this meeting is now adjourned. I will see you all next month. Thank you so much for joining.
Thank you.
Take care, everyone.